together.
Oh, great. Thanks, Amber. A double recording. We might just give it another minute, folks. Conscious of people's time and okay. I think we might. What do you think, folks? Think we might get going? Yeah. Thanks so much, and a huge welcome to everyone here for being part of this momentous day and for being here with us. As many of you know, this has been a long journey made up of many baby steps that have led to this hugely important stage to finally launch the IAIM endorsement process. I'm delighted and extremely honoured to be here today as the current president of the Irish Association for Infant Mental Health. And I want to begin today by acknowledging the huge vision, hard work, dedication and commitment of all the past presidents of IAIM and all the current and past members of the Executive Committee. All of their efforts have played a huge role in building the process that has got us here today. I also want to thank all our members. It is great that some of you are here with us today, and thank you for all the warm wishes from members who couldn't make it. The membership of IAIM has steadily increased in recent years and reflects interdisciplinary practitioners from the voluntary, statutory, community and private sector, and is increasingly widespread across the country, which of course is amazing. As you know, the mission of IAIM has always been to bring a strategic focus to the important developmental stages of pregnancy, infancy, and early childhood, with a central emphasis on the social and emotional development and the relational context in which it occurs for all infants and young children living in Ireland. Central to this has been the effort to bridge the gap between the decades of compelling research and literature to support clinical practice, education, training, building workforce capacity, research and policy development. Part one of IAIM's strategic mission was to purchase the Michigan Association for Infant Mental Health Competency Guidelines. A huge amount of work went into Irishizing, if you like, the competencies, meaning that they needed to be compatible with the cultural context in Ireland, while also maintaining fidelity with the original guidelines. The guidelines have been updated recently, and we will continue to ensure that they land well in an Irish context, while also holding fidelity to the originals. Many of you may have been with us at the launch of the competencies back in 2018 at the Mansion House in Dublin. And since then, we've been continuing to work slowly but surely to implement part two of the strategic mission, which was to purchase and launch the endorsement process. It is great to finally arrive at this destination. And I want to acknowledge how purchasing the competencies and endorsement licenses has been made possible by an extremely generous donation from someone dedicated to infant and early childhood mental health, but wishes to still remain anonymous. Regardless of whether you are involved in IMH promotion, prevention, intervention, or treatment, the IMH endorsement credential will significantly enhance the visibility and recognition of the specialization of your work and practice. This in turn will continue to embed and grow the critical visibility of early development and relationships for all infants, young children, and their families in Ireland. In a moment, I will hand over to Amber Keeler, who is working as an endorsement coordinator with the Alliance for the Advancement of Infant Mental Health in Michigan. And we have been extremely lucky to be in this final stretch to work closely with Amber in getting to the official launch today. Amber's invaluable support has been made possible by a grant that we received from the Catherine Howard Foundation, to whom we are extremely grateful. And we will continue to work closely with Amber over the next few months as we embed the endorsement process here in Ireland. Following Amber's presentation, there will be time for any questions. So please use the chat room throughout today's presentation, which will be monitored here by Grace. Amber will then hand over to Catherine Maguire, who will bring our session to a close, and we're aiming to finish at 2. On that note, a huge welcome to everyone here for the official IAIM IMH Infant Mental Health Endorsement launch. Thanks so much for being here, and a huge welcome to Amber Keeler.
Thank you. I'm so excited to be here with all of you. As Kira mentioned, I am located geographically in the states in Michigan, where the birthplace of the competencies and the endorsement. I like to say that I grew up with it professionally. It was embedded in one of my first positions. I'm social work trained. And did home visiting therapeutic work here in Michigan, and the competencies and this endorsement credential was built into the work that I was doing. Probably 6 years after being into the field, I wanted to support the growth of infant mental health principles and practices on a bigger scale, and I found my way to the Alliance to be able to support this credential across the world. I'm so grateful to be able to work with all of you all, to learn from you in advancing this credential, because we know that infant mental health is so important, and being able to recognize the invaluable work that you're all doing is so important. So today I'm going to go over a little bit of a recap of some things that you might have already heard, competency guidelines, what those are. Because it's the competency framework that the endorsement credential is built off of, it's important to root into it first. And then go over the application process, and then give you a sneak peek at the website that you would fill in your application. So with that, I'm going to share my screen. And as I said, we'll get started just digging into the competency framework with a short video that really highlights its importance and its connection to the endorsement.
Irish Association for Infant Mental Health Competency Framework, a tool for early years professionals. The Competency Framework aims to qualify the infant and early childhood mental health workforce. It is a tool that outlines the essential knowledge and skills areas necessary for all early years professionals. Developed in the United States, the Infant Mental Health Competency Framework is an inspiring call to action, empowering early years professionals to deepen their specialised skills and knowledge to support the social and emotional well-being of young children and their families. This comprehensive framework serves as a guide for professionals in understanding infant and family development, engaging in reflective practice, and fostering strong relationship-based support across systems. Babies grow within the context of relationships, so it's vital that professionals understand infant development, relationship formation, and family dynamics to truly see the baby's experience. Reflective and relationship-based skills allows professionals, whether working directly or indirectly with families, to build trust, connection, and provide meaningful support. This framework outlines the core competencies needed to hold this specialised lens of infant mental health in all aspects of your work. Anyone who touches the lives of babies, young children and their families can contribute to promoting infant and early childhood mental health. With over 20 core competencies, the Competency Framework strives to develop a well-rounded, high-quality, culturally sensitive professional. After all, babies deserve high-quality services when experiencing significant stress, trauma, and demonstrated mental health and/or developmental disorders. IAIM encourages its professionals to use this tool as you reflect and plan for your professional development. When seeking continuing education and training, ask yourself, Where might this training fall within the competency guidelines? Or how might this training support my specialisation in infant mental health? In addition to the competency framework, the Irish Association for Infant Mental Health has another tool for early years professionals. The Endorsement for Culturally Sensitive, Relationship-Focused Practice Promoting Infant and Early Childhood Mental Health. This endorsement is an internationally recognised credential that acts as evidence of your specialisation in and commitment to infant mental health. Take your experiences in early years field thus far, overlap them with the competency framework, and then when you are ready, seek endorsement to honour and validate your specialised skills and knowledge. The Irish Association for Infant Mental Health is now ready to accept applications for endorsement, and please go to our website for further information.
That little video is really just capturing how important the competency framework is in shaping our knowledge and skill base when working with infants and young children. The endorsement is going to validate that those competencies have been acquired through education, through training, through your different work experiences. It also is designed to help embed systematic quality through reflection, with some requirements around reflection within the endorsement and with the competencies embedding reflective practice throughout. This can help uphold a systematic approach to care with babies and children, to carry that lens of reflection into the work that we do. And it's also validating and honoring and really being that badge of commitment to your commitment to the healthy development of babies, your commitment to the growth and development, the social and emotional growth, wellness of our youngest, most vulnerable populations throughout the world. And I wanted to kick us off just kind of thinking about reflecting to ourselves, and either you can come off of mute and share out loud or put in the chat. What's your why? Why seek endorsement? What would it mean to you to obtain this credential? And I can share for me, as I mentioned, it was embedded into the work that I was doing, and it was just a checkbox in the beginning. And as I grew in my career, and moved in and out of different systems, I realized that this is a specialization. To hold the infants' experiences in all that I'm doing is something that not every single professional can say that they're doing, even when they're working with the 0 to 3 population. So for me, it is that validation that I hold an expertise that is different than something else. And I can't see the chat to see if people are popping things in there.
I'm keeping an eye on the chat, Amber, and we have someone who said our attendance is for research purposes to evaluate whether or not the credential could add to our service. So just someone sharing why they're on the call from a research point of view and evaluation.
I love that. We need so much more of that in this field with this credential. Anyone else want to share what brought them to the credential or here today? Maybe you need to learn a little more about it to kind of understand. Okay, we're going to talk about the application process for the most part. And there's 2 goals for the application process. That is, 1, to demonstrate that you've met competencies, and then also to demonstrate that you've met the minimum requirements. So you'll see here in a little bit when we pull up the application itself that competencies are laid out for you. And your goal through your different experiences is to show that you've acquired knowledge in this area. And then there's also minimum requirements, say a 33-hour training requirement, which we'll talk about next. that will, oh, not that well. The requirements are the minimum experiences needed to have acquired competencies. So back when this credential was first developed, the group of people, researchers, multidisciplinary professionals that came together determined that on average, about 2 years in work, on average, about 33, I'll go ahead and change my slide to show the requirements, 33 hours in continued training is what would lead to the development of these competencies. So here is just an overview of the different areas in which there are requirements. We have a couple different categories that we'll dig into a little bit. My hope is for those that are here that you'll start to think about which category you might fall into in seeking the endorsement, or which category those that you work with, your organization, to start shaping and making sense of what the credential is for you. But overall, the application process is going to have requirements around professional experience, training, 33 to 48 hours of training, depending on the category, an educational requirement from no degree required in some categories to postgraduate educational experiences. The endorsement application process also asks for professional references. On average, there's 3 that's needed per application. Some categories require some categories require leadership experience, and it's only the mentor categories, which we'll get into. And another huge important component of infant mental health work is reflective supervision and consultation. It's required for some categories, but not for all. You'll notice throughout our overview of the endorsement credential that when there's dyadic work required, you'll see reflective supervision, because we know that when we are really seeped into the relationship and we're treating the relationship, that it can be evocative, and having this specialized support embedded into your work and supporting your work is so valuable for the work that you're doing with young children. And because this is the credential is newer to Ireland, the language of reflective supervision might also be new. That's very much a endorsement credential language. You might be experiencing this thing that we call reflective supervision where you are in your work, but you might not call it that. So our friends in the States, in South Carolina, have created a short little video that talks about reflective supervision. I wanted to share with you all to start helping you identify if this is something that you are participating in. Is this something that you want to participate in? I think it'll play as soon as I change the screen.
In the world of infant and early childhood mental health, providing nurturing care and support is essential for the healthy development of our youngest children. To ensure that professionals in this field continue to grow and provide high-quality care, there is a powerful tool known as reflective supervision and consultation, or RSC. Reflective supervision and consultation is a collaborative process that offers professionals a safe and supportive space to explore their work with infants, young children, and their families.
We get this wonderful reflective supervision time where we get to brainstorm with other supervisors about challenges that we face in our teams and with our clients, and really keep that perspective and that lens of the ultimate child outcomes that are affected by all of the work that we're doing.
During these sessions, professionals have the opportunity to discuss their experiences, thoughts, and feelings regarding their interactions with children and families. They engage in thoughtful conversations in partnership with an endorsed supervisor to gain deeper insights into their work. Reflective supervision and consultation promotes self-awareness and self-reflection, allowing professionals to better understand their own reactions and emotions. By gaining a deeper understanding of themselves, professionals can make more intentional and informed decisions in their practice. RSC helps them identify their strengths and areas for growth, leading to continuous professional development. It fosters a sense of collaboration and shared learning among professionals. It provides a platform for exchanging ideas, exploring different perspectives, and developing a common language to support the emotional well-being of infants and young children. By engaging in this reflective practice in a relationship-based way, professionals become more attuned to the needs of infants and young children within the context of their caregiving relationships. They develop a greater understanding of the impact of their actions, assessments, and interventions on the emotional well-being of the families they serve. Additionally, over 30 years of clinical experience and empirical evidence indicates that reflective supervision and consultation increases the quality of infant mental health services by reducing vicarious trauma, staff turnover, and bias, while increasing practitioner knowledge and improved practice, job satisfaction, efficacy, and responsiveness.
As a supervisor, I give reflective supervision to my staff. And I realized that in order to be a better supervisor, I needed to feel and to also receive reflective supervision. That in turn will make my home visitors be a better support for the moms. And it's a parallel process where always the baby is at the center.
This increased awareness and sensitivity positively influences their approach, allowing them to provide a more responsive and nurturing care. RSC empowers professionals to build stronger relationships with children and families, fostering a foundation of trust and support. Reflective supervision and consultation is a powerful tool that enhances the practice of infant and early childhood mental health professionals. Through self-reflection, collaboration, and shared learning, RSC nurtures professionals' growth, resulting in the better outcomes for infants, young children, and their families. At the South Carolina Infant Mental Health Association, we are committed.
We can pause there because South Carolina starts to talk about South Carolina and you all are Ireland. So reflective supervision, this is embedded into the competencies, embedded into endorsement. This is that quality, systematic approach to reflection that this endorsement credential can support this practice here. You might have heard in this video that they mentioned being an endorsed provider of reflective supervision. The endorsement credential outlines a standard for providers, a standard of skills and knowledge-based areas that a provider of reflective supervision would also need to grow into in order to deliver this service, a quality service to others. Through the endorsement, we also heard in the video that a provider had mentioned that they themselves knew that they needed reflective supervision as well. It's that parallel process of I need support in order to give support to others. And that's all embedded through the endorsement credential. It's required that if you're receiving reflective supervision, it should be from somebody who is also endorsed so that we can know the quality, know that the reflective supervision meets the standard. But when this endorsement credential is new to a place, how can that be so? So we have this process that, there we go. In the States, we call vetting, which I understand means something different for you all. So if you hear me say that term, please, I invite you to hold on, what are you talking about, Amber? Because I don't want to offend or cause some miscommunication or confusion amongst us. I'm still learning from you all, so I welcome any moments of pause and teaching for myself as I get to know you and your community. But really what this process is a reflective supervision quality assessment. It's where if you are having this experience of reflective supervision, but the person you're receiving from isn't endorsed yet, because how could they be? It's just launched today. You'll connect them to me and via email or through your application, and we can talk about that when we open that up. And we'll have this conversation or interview with that provider and I'll learn a little bit more about them and help support and encourage them to seek endorsement if that's what they want. But this quality assessment is ensuring that the supervision that you've received does meet the standards that we have laid out in the competency framework, and also allows you to continue to move through your endorsement credential without having to wait for your provider, because your provider might need some time to complete their own application. So we have this period of flexibility where we can talk a little bit more about some of your experiences. So now thinking about the application process as a whole. We can think about the endorsement application process as a 6-step process. Step number 1 will always be to obtain membership with IAIM. To be connected to your hub of resource, to be connected to the place that can help connect you to or deliver trainings in regards to infant mental health will be important. IAIM is the only place the only entity in Ireland that will have this credential, and being a member is a requirement. The next step would be determining your category. We're going to spend a little bit of time thinking about the categories, because this is often the I don't want to say challenging, but it's a piece that takes some thought to kind of figure out which category makes the most sense for you. The categories are designed to represent different sectors of the workforce. What we know about infant mental health and early years professionals are we're often wearing lots of different hats. So you might find yourself in multiple different categories. So really thinking about what you want out of the credential, what are your goals, is really important. And as the executive committee mentioned, I'm here to support you all, so we can always talk through that, and I'll list out the ways in which we can connect towards the end of our time together. And the reason you are determining your category prior to registration is you need that nugget of information during the registration process. So when you're registering, you have to select which application you're registering with. Not the end of the world if you get into the application and feel like, oh, I may have selected a category that isn't a fit for me. We can always change those categories. With your membership with IAIM, your registration fees are covered for the registration into the endorsement system, which makes it a lot easier for us to talk through this step after registration. Your 4th step will be to build your application. As we heard in that competency framework video, you're taking your experiences and you're bringing it to the application process, and you're kind of data entering in your information to show that you've met the competencies through these experiences, and also that you've met the minimum requirements. Then you'll submit your application for review, and I hope our plan is that we'll have like a 4 to 6 week turnaround. So you submit a trained endorsed application reviewer will review your application to ensure that you've met the minimum requirements and a majority of the competencies. And then about 4 to 6 weeks later, you'll receive a determination. Oh, we discussed this word. I should probably say you'll hear the decision from your review. So now we're going to go into each one of these steps a little bit further. Membership. Some of you may have already have membership. Some may need to renew. And we can give you follow-up with some of those resources, but we'll talk about the categories a bit to start shaping your mind around the categories. So there's 1, 2, 3, 4, 5, 6 different categories of endorsement designed to represent 6 different sectors of the workforce. We have 3 that we call the mentor categories, and then they have separate designations, but we'll go into all of those. So our infant family associate, these are our professionals whose primary role is to promote optimal social and emotional development of infants and young children. They might be directly working with infants. They might be working on behalf of infants. This is our broadest category of endorsement. Here in the States, we find pediatricians in this category. They're not doing dyadic work, but they might be, their client is identified as, or patient rather, identified as the child, but they're really carrying that thread of optimal social and emotional development through relationships into their work. This could be a early years educator, where your or your client, if you will, is the classroom, is the group of students, not doing dyadic work, but serving on a bigger scale, again, with that goal of promoting optimal social and emotional development and wellness through a relational approach. The infant family specialist, this is a dyadic category. So professionals who are working with caregivers and kiddos together with the goal of their services to be, with the services that they're delivering are focused in that prevention, early intervention sector. And they're also, well, their goal is to prevent early childhood disorders. So something may have been identified, and I'm here to support putting in interventions early on so that we don't see bigger issues down the line for this kiddo. And I'm doing this through work with both the caregiver and kiddo together. Our infant mental health specialist category recently was refined to be very specific to mental health professionals. So those who are registered with a recognized regulatory body in Ireland and who are working with the dyad, so again, parent and kiddo together through the relationship, really, not really, that are doing infant parent psychotherapy work. So we're working from that mental health clinical lens with the dyad through the relationship to mitigate any issues that are arising within the dyad. I shouldn't say within the dyad. It could be for kiddo, and then your intervention is through the relationship. And then headed into our mentor categories, which are seen as more of a macro, bigger system approach to this work. We first have the mentor clinical, which is somebody who in their history, they've done that work that we just discussed, that infant parent psychotherapy work. And now their primary or a majority of their role is to support other clinicians in this work, or other, not necessarily clinicians, but other infant mental health professionals in this work through providing reflective supervision. Our next category in this macro sector of the workforce is the mentor policy. So this is a professional who has postgraduate leadership experience in policy development and or program administration. So this is somebody who has been in the field for quite some time, has postgraduate experience, and they may be developing policies, working at more of a here in the States, we would say a state level, and I'm not sure what the translation to state for you all would be, but in the different territory, counties, areas is more of that macro work, or they're supporting a program at large. And then last but not least, our third mentor category are the mentor research faculty. So this category is a professional who has postgraduate leadership experience, either teaching at a university level or they've done research that has been published. This category is together because we often find that these professionals are doing a little bit of both. We might be doing some adjunct teaching as well as working on some research. The mentor categories, I didn't mention just yet. And now that I'm thinking about it, I don't think I've explicitly named it anywhere in this presentation. The mentor categories have an exam that is required. So your goal with the mentor categories is to complete the minimum requirements laid out in the application, and your reviewer will be assessing your application for a readiness to sit for the exam. And then your final requirement will be successful completion of that exam. Are there any questions that I can answer now about categories? Oh, I'm seeing some of you guys thinking about what the framework and all of this means to you. I appreciate that.
Yeah, I was just going to say, Amber, a few people have put in their whys.
Yeah.
So if you want me to read out some of the whys and pause for people to put in any questions they have about categories, or we can do it at the end.
Yeah, we can talk about the whys as it
Some of the
kind of.
whys. Yeah, just to give a sense of kind of who's in the virtual room. So someone who's working at the National Tongue Tie Centre in Clonmel, the credential will help me to be a better voice for newborns and their families who are under extreme stress due to initial feeding and sleep issues due to motor restrictions. It will validate the quality of service provided to the community. For me, it would be the validation of the years of training, the skills I've acquired, and that I do hold the baby in mind, and that it is a qualitatively different experience for all that I work with. The framework will help maintain standards in this area of work, offer clarity with the competencies that are required to work in the area, give practitioners a path to get competencies recognised and validated, develop, and the credential becomes known as we develop and the credential becomes known in Ireland. It'll also help employers gain clarity on competencies required to work in this way as an internationally recognised credential. And the credential moves with you wherever you work.
Well, yes, thanks for mentioning that. Yes, with this being we strive for this credential to be 100% reciprocal. That means as you move through Ireland, or Ireland wouldn't want to see you go, but if you did and you went to another state that has bought into well, let me take that back. It doesn't leave you. Once it's earned, it stays with you. If you leave Ireland, it can transfer with you if you go to another alliance place. If not, you'll maintain your endorsement just in Ireland. Which I don't know about your guys' experiences here in the United States. When you go to a different state, it's a different regulatory body that is overseeing your license, lots of different things. And sometimes it can be a challenge to move. So this is quite nice to be able to have this expertise and this standard of care and knowledge and skill for infant mental health be the same across the world. Thanks for sharing your why. And it is such an honor to be in the position that I'm in. I get to join in communities around this credential, and I get to learn so much about it. And I'm very, very excited to learn about how the credential will be helpful, how to support its growth in your community. Thank you. So if there's no questions about the categories just yet, which there are a lot to hold on to. So we have some resources developed for you that I'll pop in the chat here in a bit that can help you look back over the categories, kind of mull over where you might find yourself. So step 3 is registering. So you've became a member, you have determined which category you're going to seek, and now you'll register in the endorsement application system, which we affectionately call EASY. So this will be a completely separate website from what your website for obtaining and like syncing into your membership benefits, but you'll find it in your membership portal. I'm not sure the right word, your membership website. So this endorsement application system, EASY, is where you will apply for your endorsement, and I'll show it to you here in a bit. This is also where you will come back and manage your renewal. And we'll talk a little bit about renewal. And this also could be a place where if you're using the competencies and this endorsement application system to as like a professional development tool for yourself, then you can come log in, enter in your trainings, assign which competencies you've learned from that training or you've acquired from that training, and begin to see like where your professional development might have some gaps and where you might want to focus some of your energy in the future. Registration is very, very simple. It's just giving your name and address, and the address is there to ensure that you're in the right instance. So each state has each state or country has their own version of this endorsement application system, and we want to make sure that you're connected to the correct one. So the address is there to verify that. The registration process on like an internal end, we ask that you give us about 2 days. So you'll register and kind of pause right there. And then after roughly 2 days, you'll receive 2 emails, one from the endorsement system that's going to give you a temporary password to allow you to log back in, and then one from me, welcoming you to the easy system, welcoming you to this process, and giving you some resources to help you through. We ask that you give us the 2 days to allow for the processing because my time is limited with the Iris Association, and this wonderful, wonderful executive committee of humans here are all voluntary. So we'll give grace and you'll give grace to us, hopefully. The next step after registration and after your registration has been processed is building up your application. As I mentioned, it's heavy data. Well, that doesn't sound great. It's data entry. You're entering in information. You're not required to upload proof. So you're not uploading transcripts. You're not uploading transcripts for education. You're not required to. You're not uploading certificates from training. That's not required. You're going to enter in your, whether it's a training detail, work experience, into the application. And once you've entered in your information, you'll start to assign competencies learned from that experience. And then once you submit your application, there will be a processing fee. The fees are laid out here. They're different per category. And the differences typically come from who the professional will be in that workforce. So really trying to have an equitable approach to the fees. And the processing fees help cover the processing of this application. So really looking through the application to determine that this specialization in infant mental health, as determined by these competencies, have been met. And all of this is done within the EASY system. And as I mentioned earlier, the final step after you've submitted would be a waiting period, if you will, of about 4 to 6 weeks. I like to plan ahead and give you a date for when you can anticipate to hear back, and then we'll be in communication if that date has to move. But a reviewer is going to go through and ensure that those 2 goals of yours have been met, that a majority of the competencies have been acquired through your experiences, and that the minimum requirements have been met. And we always try to give meaningful feedback no matter what the decision is. So if endorsement is awarded, you'll have a credential as well as a feedback letter is what we call it, something that a reviewer helps put together to say, we've looked over all of your experiences you've entered and noticed that this might be an area that you want to focus your attention on in the future as a way to support the continued professional development. I wasn't sure if I made the slide or not. I couldn't remember doing it. So once you've earned your endorsement, then you are tasked with maintaining it. Again, with that systematic quality of care, this credential is, with its renewal requirements, it's requiring that we're continuing our training and education in infant mental health, that we're staying up to date on anything new that is emerging within the field, any new principles, practices, relationship-based interventions, that we're continuing that growth. As the field grows, that we're growing with it. Where reflective supervision is required for that category, it'll be required to be continued. And then, as always, membership too, being able to be connected to your resource hub that's going to help support this credential is a requirement. So renewal works on a fixed 3-year cycle. So your first renewal, depending on, I'll say it like this. This is new, so if I sound fumbly, please forgive me. We've just changed the renewal process. The next renewal cycle will be December 31st of 2027. What your requirements are will vary depending on when you become endorsed. And then after that first renewal period, it will be 3 years, and you can anticipate that the requirements are roughly 15 hours of training per year. Or 12 hours of reflective supervision per year. Again, this is all detailed information that you can find throughout the EZ website and in your feedback letter. So when we're congratulating you and welcoming you to the endorsed community of professionals, we're going to lay out what your expectations are for maintaining this endorsement. And when the time comes, you'll come back to the EZ system to process your renewal. The renewal is completed on a attestation audit system. So you'll come in and attest that you've met the minimum requirements for renewal, and acknowledge that each renewal cycle, there's an audit, and you might be pulled in that audit. And what the audit will look like is providing more information about your experiences that you've obtained for renewal. I did see we wanted to go back and talk about the family specialist. That in the chat. Was there another one? Is it Maribel? Do you have a specific question that I can help with the family specialist?
Like, no, oh, just a little bit overall. Well, I do have a specific one, and it's about the reflective supervision as well. So if your work, like if you don't have all the hours achieved for the reflective supervision, can you do it at the same time? Like apply for the endorsement and work on the hours for the supervision at the same time, or do they have to be finished by the time you apply?
Yeah, thank you for that question. The expectation is that at submission, you would have all of the requirements. So you can come into the endorsement system at any time in your acquisition of this endorsement. So if you know that you still have a couple months or hours to obtain with reflective supervision, or maybe you have a few trainings in the future, you can certainly come into the system and start adding in any of your information.
Great, thanks.
Were there any other questions about categories?
Nothing in the chat anyway, Amber.
Thank you.
And
Thank
Amber,
you.
can I just ask you to clarify, when you start your application process, which you can start, once you get into EZ, do you have to do it over a particular period of time, or is that completely open-ended?
Thank you, Marie. No, it's completely open-ended. So how we are structuring things for now with IAIM is that you can submit whenever, and our decision cycle will be rolling. So as submissions come in, we will dish out and connecting or coordinate rather to reviewers. So no. You can work as you need it. It's a self-paced process, if you will. And registering is free to you as a member, and really is about, I'd say for the individual, just how much do you want to know? When do you want to get into the system?
Thanks,
Amber, Bridget has shared a question wondering about what category she might fit into. So I'm not sure whether you want to chat that through here now. I know you're going to share your details, Amber, so that people can actually connect in with you directly if they're trying to figure out which category.
Yeah.
But Bridget shared that she's an accredited leader in Lalesh League Ireland, a qualified children's and adult nurse, working closely with mothers and babies in offering support 24/7, voluntarily in the initial stressful stage of motherhood parenthood. So she's wondering which category she would fit into. So again,
Yeah.
not sure whether you want to, share your details with Bridget to follow up on that one. Many people on today may be in that phase of starting to think about what category they might fit into. And I know probably the chance to chat with you individually will probably be really helpful going forward for people. So that will be an option going forward, won't it, Amber?
Yes, it will. And I think, Bridget, what you've described in your position is an experience that lots of professionals have, where I could almost imagine that you could fit in multiple categories, which at this point, I would think, let's have a conversation about it. Let's learn about your goals for the endorsement. Let's learn a little bit more about your experiences. So I'll table the specific response to your question and give you an invitation to connect with me at a later time. And as Grace had mentioned, some of the resources that are available to you through me we will host a monthly office hour. So you can expect most Wednesdays at 1 p.m. that I'll be sitting on a Zoom or Teams in a virtual space for you to join in. I say mostly because I know one Wednesday here in the future I won't be able to attend, but most of the time, Wednesdays at 1 p.m., I'll be in a virtual space to where you can just hop in, ask a question, and leave. I also really like brief one-on-one appointments. Your work is so interesting and can be so niched that having a one-on-one conversation is just so valuable. So I have a flexible scheduling link that will allow you to see my open availability, and you can look at yours and we can pop in for a short chat. As always, we have emails that you can send whenever you have a question, and within the application, I'll show you here in a minute, there's a comment feature. So we can talk inside of your application as well. Right now, I'm going to stop screen sharing and share with you a few tools that we have. I'm going to pop them in the chat, and then you can download. I think that's how Zoom works, and look over them at your own time. Two of them are Alliance created. So the Alliance for the Advancement of Infant Mental Health, the organization that supports the development, advancement, and implementation of the credential. They have required documents that we give out so that we are talking about this credential in the same way. And then we created what's called a pre-application tool. And this tool is designed to go with you where the easy application can't go. So for a while, I had a filing cabinet in my home that had all of my trainings, but I was spending time in my office working on the application. So I had this wait, how do I need that file from there over here? And my resume was on this computer and not that computer. So it's just a helpful tool to kind of jot down some things that you want to put into your application. So I'm going to stop sharing. pop those in the chat, and then I will reshare in a second and show you the application system. If anyone has any other questions while I upload these documents for you, I'm happy to answer.
Amber, we'll also be able to put those documents on our website, won't we? Alongside all the other supporting. So it'll all be in one place if people don't get a chance to download it today as well.
Yes. Okay. The other document I popped in was it's kind of a snapshot view of the endorsement, all the different categories and their requirements. So because finding your category is a personal endeavor, going into each and every category and each and every of it specific requirements didn't seem like a good use of this time today, but this is a document that you'll be able to mull over as you're thinking about the work that you're doing, thinking about the different experiences that you've had. Let me pull up easy to show you all a bit about the system. Okay. So here they are, the endorsement application system. When you're coming to register for the very first time, you will select new application and select register. I won't be able to go through the whole process because I have used every email that I have to play around with this registration, but very simple. Selecting the category, you'll notice that your registration fee has no numbers assigned to it, and that the processing fees are issued here. As I think we had mentioned that at some point the competencies were Irishized. We still need to do some Irishizing of the EASY system as well. So that's going to take a little bit of time on our end. We have a very, very small IT team that is helping support all of the versions of this website. So we had the $ where you guys are the euro. I'll point that while the $ is here, these are euro prices. But you're entering in your, that should be fixed too. It's not called Irish where you are. You'll enter in your personal information, and we have a note here that asks that you use a personal email address. It's a suggestion, not a requirement. And the reason that it's noted here is that we've found that some agency email addresses block some of the notifications that come from the server. So I've had applicants start with their personal email and say, like, I never go to that email. Can we switch it? And it's totally fine. Just know that there may be some notifications that don't get to you if you're using if you're using a work or agency email address. So step 1 is filling this out, and then step 2 is will show the registration fees, but it'll be zeroed out for you. So you'll just click buttons. And now I'm going to log in and go to, I have many, many applications in the system, so I'll show you one. Your ability to log in will only happen once you get those two emails from me and the EASY system. You'll get a temporary password, and that's what you'll use to log in for the first time. Then you'll go to profile, and there's lots of things on this page because I play in the system a whole lot. You can fill out your demographics and then press save, and then you would update your your password here to be one that you could remember. this endorsement button, and then my endorsements will always take you back to your application. So if you find yourself on a page and you're like, oh, how do I get back? Endorsements, my endorsements. And while your application is in progress, it'll show at the bottom here. Like I said, I play in this system a whole lot. So you will probably have one sitting here as you're working towards the endorsement. I have what feels like 100 because I like to look at all of the applications. I'll pull up this application. So when you press that edit details, it'll open your application in full. And this menu here on the left side are the different sections or tabs of your application. And they outline the requirements for each. So I mentioned the competencies are outlined in the application process, and one of your goals through the application process is to document that you've met a majority of the requirements. So a majority of the competencies. So we see a whole bunch of competencies listed here, and your goal isn't to meet every single one. And you'll know that as you're working through the application, as you select competencies, these green check marks will show up here. So your goal isn't to have a green check mark in every single area, but a majority of the competencies. And then the requirements are laid out at the top. Sometimes Easy moves a little slow. And it could be my internet at this point. So the requirement for each section is listed at the top of the page and will vary per category. And then there's a little tips for completing the section that you can find below that. In general, this is data entry. So typically you have a like a preloaded entry within each tab. So you could edit that and work from there, or add a new entry, which you'll always find this button down in the bottom right-hand corner of the screen. And you're just filling out the prompts here. There's an option to upload your transcript for education, because if you have a degree or an educational experience that aligns with the competencies and you want to show that you've met competencies through your educational experience, you will be required to upload a transcript at that point. But if you've had a number of trainings and feel very confident that you have acquired competencies through trainings, then this isn't required for you. It's an option. And even for degrees that don't, I'm going to pop over to the competencies that don't, that might not completely align with infant mental health principles and practices, there are some competency areas that I find people do use their educational experiences to show that they've met, such as these, like writing or listening and speaking. I took a speech, I think a public speaking class within my undergraduate experience, and that felt like the place that I really learned how to speak openly in different settings. So that was something that I used my education for when I was completing the application process. I'll show you the references section of the application. It's required to have 3 professional references. This is all completed through the application process. So your references are completing a questionnaire. It's like a questionnaire style. You'll enter their information into this website. Then you'll press send, and you'll send effectively a link to a questionnaire styled reference. We call them reference rating forms, but a professional reference that they'll complete. And when they save, it comes back to your application. So all of the professional reference requirements are completed through the application itself. This is the comment section that I had mentioned in kind of the resources and supports. So if you'll notice that I'll come into applications from time to time and give you some encouraging words, any feedback on how the application is shaping up. we really try to give support through the application process to lead to successful reviews. We want to help have a smooth review process. So I can leave a note here for you. You can leave one for me. I'm going to pause for questions. No? Okay.
All good in the chat anyway.
Thanks, Grace. This status, this very first menu option section of the application, the status section, has an overview of your entire application. And this section is helping you decipher when a requirement has been met. So you will see green boxes when you've successfully met the requirement by adding in your data and your experiences into the application, and it'll remain yellow while you're still working towards that. Once every section listed here is lit up in green, you'll get a big button down here that says Submit Application for Review. So at that time, you'll be able to submit, pay your processing fee, and then we'll start to coordinate that review.
Amber, there is a question that's come in relation to reflective supervision. What are the requirements that allow a supervisor to be suitable for IMH? So I think kind of connecting back to that quality assessment that you probably had referenced.
Yeah, that's a great question. It's the competencies, really. It's the competencies and the requirements. So it's a conversation with the provider to be curious about their experiences within infant mental health. What are their trainings? What trainings have they attended? Have they had any formal trainings on reflective supervision? Really trying to understand is the reflective supervision consistent, collaborative, and reflective in nature? And we do that through a conversation. So there aren't, I'd say, like concrete, this is the requirement, because this reflective supervision capacity, as we have reflective supervision defined in the endorsement and competency framework, is growing within Ireland. We have to leave room for flexibility. So I hope that answered your question enough.
And Amber, the important bit in that space seems to be that assessment that you'll do with the supervisor, isn't it? It's like, again, it's about having that conversation and having some format of kind of assessing what the supervisor is bringing to the space, really, isn't it?
It is,
To be able to call it, really. Yeah.
Right. Yeah. It's required that we go through that process of having that conversation, and it really would be the only way through that assessment is to be able to talk through what are their experiences, how do they view their supervision, how would they describe it, and to see if it aligns with the the competencies laid out in the framework.
And I just have a question related to that. Do you have that conversation with all supervisors, whether they're endorsed or not, or is it just people who are not endorsed?
Yeah, it's just people that are not endorsed.
Yeah,
That was a great
okay.
question, Lori. So once somebody has gone through the endorsement process, it's the application process that's taking place of the conversation. They're documenting through their documentation of the competencies, through their documentation of their own experiences that they've had, that their reflective supervision aligns.
That makes sense, yeah.
Do we have endorsed supervisors in Ireland? I'll have to send that back to you.
Amber, could I ask a question?
Yeah.
I obviously don't have endorsement, obviously, as you've just stated, but I'm just thinking I was hoping to go for the specialist, we'll say. But I also, as part of my job, offer reflective supervision, but I'm not endorsed. So then which one do you go for? I know you probably shouldn't be answering personal requests, but it's just, as you said, then if somebody puts me down as their supervisor and I'm not endorsed, you'll be contacting me as well. But I was hoping to go for my own endorsement. Now I don't know which one to go for.
As far as category itself, we can help, I can help you
Yeah.
determine that. What I didn't talk about in this presentation was the endorsement that specifically captures your expertise in reflective supervision. The reason I didn't do that is because we have to be endorsed first in order to receive that. But for you and for anybody who's in the position of supporting others through reflective supervision, I would encourage that we have a conversation about where you are in your acquisition of the endorsement and determine what is like a feasible time frame for you to complete that endorsement. Because the moment you become endorsed, all of your reflective supervision you've provided to others is now qualifying, and we don't have to go through that process of having that conversation again. If there's still some requirements that you're working towards, we can consider having that conversation and then having you as an approved provider to where your reflective supervision will count towards others seeking the endorsement while you're still obtaining your endorsement, if that makes sense.
Yeah. But if you were to go for that's the one I'm, my 80% of my job is the actual working with the parent infants. But then there's a small part of my job that I offer this supervision. So yeah, anyway, I'll have a think about it and connect with you. Because that's fine. Perfect. Thank you.
Amber, just thinking of the question about do we have endorsed supervisors? I suppose a number of us are endorsed in Ireland, so we probably need to get on a register and get that piece of work completed. Would that be the case?
So I think what we would want to do for your community is define what is a qualified endorsed reflective supervisor, and then route people we do have a registry of endorsed providers, but you would need to hold in mind who qualifies for reflective supervision for that. I will share the registry, which is all housed on the EASY website. So when you're not logged in, endorsement registry will show up here. Anybody in the Infant Mental Health Mentor Clinical or anybody with this endorsed reflective supervisor would qualify as go ahead, Catherine. Were you gonna add?
No, I was just going to say I'm not there, so I need to send an email, get that sorted.
And some things that a lot of associations keep like a list of providers of reflective supervision who are open to receiving kind of like a referral that are open to provide to others, and that ends up being a resource that we can share with the community. So in the newness, this would be something that's in development for us.
Sure. No, that's grand. Thanks. I'll follow up with you about that. My name on the list.
Can I just maybe come in and maybe clarify a few things that might be helpful just in relation to that question? I suppose as part of our preparation for launching the endorsement, there were a number of people on the committee and others outside of it who have been part of what we call the leadership cohort. Prior to that, we've had other members in Ireland who went and got endorsement through the States, Catherine and our colleague Audrey being two of those people. So we have a small number of people who have the endorsement at present in Ireland, and it's really all through the association. Some of those people do provide reflective supervision in relation to their current roles and their work, and the piece around that reflective supervision add-on, as you're saying, Amber, which is available for people who already are endorsed, that's actually very new in the Alliance. It's probably only come on stream within the last maybe 12 months or so, I think, as far as I'm aware. So in terms of our association, we will get our list completed in terms of those people who just came on screen there, were people who are part of the leadership cohort, and we have another small number of people who would have been kind of the early adopters in terms of the credential, and like Catherine and Audrey and some others, members of our association. So we'll get them on the list as well. But as you can see, that group, to answer the Dean's Rat, the person who's put that question in from Dean's Rat, the number of endorsed professionals within Ireland is quite small at the moment, but what we're hoping after today is that we will have a number of people who will be looking for endorsement, and we'll grow that community and grow it over time. And then, as you were saying, Amber, the reflective supervision piece is a developmental piece of that, and we kind of need to kind of hold that space and kind of grow with it over the next few years, which is what we're aiming to do, which is why there is the fallback position whereby if your supervisor isn't endorsed, for example, yourself, Suzanne, yet you are providing reflective supervision, we're providing a space for that where there's some form of assessment to see, yeah, will this work in this space, with a view to then hoping to build up the community of endorsed professionals. So that's a very long explanation, but I think some of that contextual stuff is kind of important as well, Amber.
Thank you. Very.
Thank you for that, Marie. No, it just kind of makes sense. It's just when you're kind of thinking of, the requirements, I'm kind of going, okay, where am I going to look for, or is there a list of? And I know it's probably at the work in progress, which is great,
and all we'd ask from today really is communicate with us. We want, perfect, and I think it really will grow over the next year. Yeah.
Thanks a million.
You're welcome.
I just put my email in the chat for you all if you want to grab that. That would be one way to get a hold of me. I just remembered I haven't put my signature into this email yet. What I like to put in my signature line is that link to connect one-on-one. And I'll pop back over to the easy system to show you that if you weren't able to copy the email just now, or you're not in a space to be able to pull from the chat, that the resources available to you are listed right on the home page of that easy system. So you can schedule the one-on-one by clicking this link. Here will be the link for our monthly office hours and my email listed here. Oh, the email's wrong. I'll change that as soon as we hang up. Are there any other questions or things coming up for people?
It's probably worth at this stage as well, Amber, just to say that in terms of where, there's a lot of information coming at people, I suppose, and that's the reality of these type of systems, but that we will, in terms of how to access Easy, we will have the Easy link in our members section of our website. So those of you who are on the call who are members, you'll just need to log into the IAM website, go into the members section and click on the Easy link, and all those frames then that Amber has been showing us there in terms of the Easy system and the kind of the data entry and all that you will have access to all that, and you will have access to the competency framework, because the competency framework is embedded in that system. So the outline of the competencies will be there as well. So you kind of have to play around a bit with the system, so in order to help for a lot of the stuff that we've covered this morning to land. And for those of you who are members, I mean, Amber's already said this, but just for emphasis, we haven't introduced another fee to access the Easy system. We're incorporating that into our membership fee. So you don't need to pay anything to access the system. And as we say, you can start your application at any time. There isn't any, you can do it over whatever period of time you want to do it over. And it's only at the submit stage, when you've got all your application done, that we'd be looking for a processing fee, which really is Amber was saying, just helps with the time that's needed to look at these applications, and helps us to employ someone like Amber to coordinate it, because it would be impossible for us as a committee to do that, given that we're a voluntary committee. So that's just wanted to emphasize some of those. You've already said all of those, Amber, but sometimes it can be, you know, it's hard to keep track of it when we've covered so much information. So essentially via the website, via the members section is where you'll get that link.
Thank you, Marie.
I was just going to say, Amber, that I remember, as Marie mentioned there, a few of us last year applied and received the endorsement credential last year. And just that initial stage of it is a lot of information, and almost being quite intimidated by the process. But actually, once I stepped in, it was actually so much easier. And it literally is, as it says on the tin, easy. And I realized how visual a person I am, because it also tracks your progress with the application, which I think you mentioned as well, Amber, which made it so easy, and that you can just dip in and out and go through all those different categories that you showed us earlier. So yeah, so it's a lot of information, and at the initial contact may look quite intimidating, but actually once you step in, it's very easy, and the resources are amazing. So
Yeah,
just
thanks
wanted
for
to add that in.
Yeah, that's not a unique experience. A lot of people come, and when I think about those who are carrying infant mental health principles and practices into their work, sometimes they're the only one in their agency or their workplace that have this perspective. So to bring it to an application process that will be assessed might feel just produce some anxiety. This is my specialized work that some people may have to fight in their organizations to carry this piece into their work, and to have it reviewed and assessed could just elicit some things. I think my hope is that everybody who comes to this easy system, at the very least, you know that you're not alone in it, that there is a supported guide for you all, me, to help you through the application system. And as we start to build an endorsed community, each other will be that source too.
Yeah, I think if it's okay to add to that, Amber, and to what Kira is saying, I think having gone through the endorsement, and I know it's quite a while ago, it's 2006 when I did mine, but I did it with another colleague, with Rochelle Matach, who's now in Perth in Australia. But the value of maybe journeying through endorsement with somebody else at the same time can be immense support. So if you're in an organization where there is one other, that can be really helpful. Or if you're you're on your own in another organization, maybe there's a way we can link you with a colleague in a respective organization, so you can journey together. So that can be helpful. And I think the other thing that I learned, it really gives you a lot of meaning making when you are taking part in a course, to begin to think about knowledge transfer and how am I going to embed this? How am I going to integrate this? And that the days of going to a course and coming back and leaving the information in a jotter are well and truly gone, because you'll want to think, how am I going to apply this to my practice? So that's been one of the great things about the endorsement. It really does keep you really focused about how you're going to add this to your practice in infant and early childhood mental health. So they were some of the learnings I had at the time, and still have for each training that I go to. How will I implement it? How will I integrate it?
Thanks, Catherine. I can't believe that was 2006. I'm here kind of a bit thinking, oh my God, the passage of time, you know, and how you know, trailblazing that was, really. I mean, we've been always, I suppose, in the association working with this end in mind. And you know, it's very significant today that we're at the position that we can actually open the endorsement application process for all our colleagues in Ireland, and it really is fantastic. But I can't believe it's nearly 20 years. That's been kind of a bit sobering, really.
Yeah, but I think it just maybe Amber might say this, but I'm sure most other organizations, it takes time for the organization's readiness. And as Ciara said in her opening address, every president over the since the development of IAM has in one way or another set the foundation stones for Ignite today. And many developments had to take place and need to be in place for our organization to be able to launch the competencies today and to launch the competency, the endorsement today and the competency license in 2018. So it's foundational work, hasn't it?
Absolutely.
Yeah, and I'm eager to, in my position, being able to step into different places geographically to understand how they're and help support the growth of the endorsement credential. I'm encouraged to see how having time kind of sitting with the competencies will support the growth of the endorsement. I learned quickly that there sometimes is a disconnect between the two tools, and you guys have had time to build that foundation around the framework. Because that's the, like, what do people say, like the bread and butter, like that's the piece that informs the credential. The credential is the validation, the badge, the outward facing symbol that you've acquired the competencies and leaned into that framework. There are no other thoughts or questions. I think, do I hand it over to, is it Catherine that I'm handing it over to?
Yes, thanks, Amber. Yeah, that's okay. There's no more questions. You're okay, Catherine, too. Thank you so much, Amber. That is, I think we've all probably not said it enough to you, Amber, but I think it's fair to say we've been meeting Marie, Grace, Amber and myself have been meeting over the last few weeks just to prepare for today and just to acknowledge your support has been invaluable. And yeah, going back to your point, we are a voluntary organization, and I'm not sure, I'm looking at Marie and Grace here, but I'm not sure we would be sitting here today without your support. So thank you so much.
Yeah, I agree. It's really important to have the Alliance with us on this journey, and to really, and as you said at the beginning, also, you know, Catherine Howard Foundation have been instrumental in allowing us to employ or to contract out the coordinator piece, you know, because it's just not possible to do it as a volunteer, because we want to be able to support people who are going through the endorsement process. And as Catherine was saying, we needed to make sure that a lot of this foundation was in place before we did open for applications, because we want to do it correctly and professionally, and we're in a good space to do that now. Yeah.
Yeah, so I might just bring it to a close then by saying thank you to Ciara, to our president, Dr. Ciara McCarthy, just for your opening address, Ciara. I think you really presented just the strategic plan that we've had for IAM and outlined that very clearly, and particularly the work that needed to go in place since the launch in 2018 of the competencies. And it is, as you've all said, it's a momentous moment. Sometimes in an organization that still feels very, very young, to be in this place today where we can validate the credentials of our early years workforce, and for all of you that work with infants and toddlers and their caregivers, to be able to have a process where we can credential you and what you do, and for employers, I think is momentous. And just adding again to, you've just said it there, Marie and Ciara, just the Alliance for the Advancement of Infant Mental Health has really been our scaffolding for a number of years. And we couldn't be where we are today without them. And particularly to you, Amber, your presentation today was crystal clear, and you really outlined very succinctly the steps that we need to take and just the journey and the whole, I suppose, framework surrounding endorsement. And I think you made that very, very accessible, and we hope it will encourage and motivate all of you that are interested to begin that journey today, and in the knowledge that that scaffolding that those of us that have experienced in the past will be there for them, for members going forward. Yeah, it's been, I suppose, immense that we have behind the scenes a private benefactor, and we, again, as Marie said, we really acknowledge that person today, and to have an outward member of the public believe so much in our work to enable this process, I think has been momentous for us. So on a day like today, we do think of these people. Thank you all for joining us. We look forward to seeing many of you as you begin your application journey. It is a moment of change in Ireland to think that we can recognise the importance of early infant and childhood development, recognise all of the early years workforce that do such an amazing job to support this compelling period of development, and that we now have a framework that we can endorse and validate what you do in the workforce. So we look forward to hearing from you. As Marie said, communicate with us. There's been a lot of information today, but please do get into contact with us. And if there's anybody that wants any further details, please send us an email. And I think you have the email for endorsement, iam@gmail.com, which Amber has placed on the chat. So we just look forward and delighted that we have this process beginning from today.
Great.
Thanks, Catherine.
Yeah.
And thanks so much to everybody who's here today. We're delighted, and yeah, it is an absolute honour. I'm conscious, Catherine, I'm the current president, but I think we were chatting before we came on, and you're the founding president, so that really feels like we've bookended this morning. So that's so yeah, just thank you so much to everybody. I think the recording, am I right, folks? The recording of today will be on our website, and then the link, hopefully as soon as possible, will be in the member section only, because as Amber said earlier, you do need to be a member to go through with the application. So thank you so much we really appreciate you being here. We really appreciate all the well wishes of members who couldn't make it today. And a huge thank you to you all. Without the membership, we don't really have an association. So that's so important. And just again, just to echo the huge thanks to you, Amber, for helping us. It feels like I was listening to the news coverage of the Irish women's relay team and the mixed relays, and it feels like we're kind of on that the home stretch with Charlene Maudsley. So thank you so much. So thanks very much, everybody, and really looking forward to hearing from you. Take
Thanks,
care.
everybody.
Okay.
Thanks,
Thanks a
everyone.
lot. Bye-bye.